really, I really want to say thank you for being here. And what I'm gonna talk in my talk, my speech is the choice of the filler. And there are a lot of lectures regarding the filler and area matching. But today I want to put a little bit focus on the characteristic of the tissue rather than the filler. For example, as we all know, Lorient filler has 3 different products, right? Number 2, 4, and 6. And this is available in Thailand and Indonesia, right? And we are using it. So we know that the lifting capacity, elasticity, and cohesiveness is different from number 2 to number 6. And it is not surprising that number 6 has the highest lifting capacity, the highest elasticity, and also the highest cohesivity, right? So let us just see how these values actually apply to our facial anatomy or histology. Actually, this is my personal viewpoint on the choice of any type of filler products and techniques when we are doing the filler injections on the face. I call it the tissue filler rheological matching. Actually, what we want when we do the filler injection is that the injected filler can mirror the natural tissue for natural result, right? So we may use the G prime and the cohesiveness of the filler as our key metrics for that matching, right? So maybe we can say it like that, like this, like in this table. Delicate areas such as periorbital region definitely need low firmness, the filler. But in contrast, the jawline, the nose, and even the chin need very high G prime, as we know, because those areas need actually the support. Okay? The lips are quite different, very unique. The lips and the perioral area require very, very high cohesiveness because the injected filler should handle the constant movement in multidirectional way. Oh, so just what I want to say is that we have to think about the anatomy for safety and the injection depth, but also we have to think about the physical characteristic of the tissue. Okay? What we have been doing for several years is that we try to understand the anatomy and the filler rheology. That's very important, but we have to now think about those 2 different factors together, because what we are doing is injecting the filler into the tissue. So first, for example, the forehead. Professor Kim's lecture gave almost every information on the forehead anatomy. Okay? Very important. So now is our turn. We are injecting the filler on the forehead, right? So, this sectional anatomy highlights that the skin is tightly bound to the muscle and the subcutaneous fat, as Professor Kim already said, is usually very low in quantity. That means it is in the forehead. The forehead is a very high stiffness environment, especially for women. We tend to think that the woman's forehead is very soft, but as you touch your forehead, this is really, really stiff environment. So the injected filler should resist the fatigue, right? So soft filler is okay, but we prefer the stiffer, more elastic filler. So we know that we are doing that, but what I want to say is that let us just think of again why we are injecting hard fillers on the forehead rather than very soft. Okay, the G prime value, and I can say that Lorient, especially number 6, is one of the very high elasticity filler, right? So maybe we can say that it is very suitable for forehead augmentation. Of course, when we are injecting the forehead for different purposes, maybe we can use the soft one. But what I'm saying now here is that if you want to support the structure, then we need hard one, elastic one, and cohesive one. And as you see, the result actually is a very round and smooth. And we have to also think about the facial muscle movement on the forehead. And the forehead, the frontalis muscle, constantly raises our eyebrows upward. So, and the corrugators, the medial movement. So those combinations tended to move the injected filler in a more central facial, the more medial aggregation. So high cohesivity filler and low cohesivity filler will behave different, even though both of them has very similar G prime value. So always think about the cohesiveness. Cheeks are different. Basically, cheeks are anatomically very complex. They have deep fat pad and they have superficial fat pads, and there are several different fat pads, even though in the same plane. So maybe we can say that cheeks are highly complex in anatomy, and when we think about the dynamics of our facial expression, it's a very, very dynamic area and very pliant area. Unlike the forehead, for example, cheeks has more fat and stretches easily, right? So we need a filler that support the mask layer, but we also want a natural movement. So using a very elastic filler like Lorient number 6 may be good, but usually it is not a very recommendable way. So what would be the best Lorient filler fit for this cheek joint? I think Lorient number 4. Maybe we can say that Lorient number 4 is a dynamic balancer because it has a moderate degree of G prime, but also the G prime value is sufficient for the cheek. Well, personally, Lorient number 4 is my best choice for cheeks because it lifts the heavy fat pads that causes the sagging. But it is also cohesive enough to move naturally with the mask. So maybe we can say that cheeks, we need support and movement also. The balance is very important because it's a facial expression area. For example, this is my case to what I call is a Turkish patient, and I injected the Lorient number 4 on the medial cheeks and number 6 on the lateral cheeks. It's a very small amount, and what we see in this slide is that even though I didn't inject anything in his in their nasolabial fold, but we see the improvement in nasolabial fold. So this is what we call filler-induced lift effect, right? This is really evidently seen when we are treating the Caucasian patients rather than Korean patients. So maybe you can use number 6 on the medial cheeks. It's okay, but in that case, the dynamics perspective, we are losing some benefits of smooth movement. So number 4 is better, I think. Perioral area, as the illustration on the right side shows, this area experiences constant multi-directional stress from, of course, the muscle movement, especially orbicularis oris muscle and other perioral muscle. So this tissue needs very high dynamic elasticity. When I say dynamic elasticity, is really close in relation with cohesiveness too. And also what we need is very quick elastic recovery, right? When our facial expression is gone, then the filler should return to its original injection site. Very important. So this unique high motion environment in this area actually forces us to use a specific product which will be very suitable for this region. And I think Lorient number 2 is best one, including the lips. Soft but cohesive enough. There are many soft fillers around the world, right? But not all of them is also very cohesive. So not only the Lorient filler, but also when we are thinking about other products, please keep in mind there, heavy oral area and the lips needs a soft but cohesive filler. So with those type of filler, we can maintain a natural look during speech and expression, which is what we do every time. As you can see, the red box in the right graph, Lorient number 2 almost perfectly mimics the G prime of the skin and soft tissue. Our skin and soft tissue has their own G prime value, of course, right? And usually, this Lorient number 2 type of soft filler is injected rather superficially, right? Just under the muscle or even inside under the dermis, right? So what this means is that by matching the filler's firmness to the firmness of the skin and subcutaneous fat layer, then if we match them, we can achieve most natural integration and very natural feel for the patient too. So I think that this may be the most lovely part of the Lorient number 2 filler when injected around the mouth, perioral area. So I can say that Lorient filler is generally a highly resilient filler, but especially the Lorient number 2 is very characterized to that resilience, recoil, elastic recoil, okay? So maybe for example, nasolabial fold, we need structural support and some resilience, maybe Lorient number 4 and the combination of Lorient number 2 will be good. And as clearly seen in this slide, this is a case from Dr. Osmilton from Brazil. It's a fantastic result on the very dynamic wrinkles around the mouth, improved a lot by injecting Lorient number 2. All right, clinically, in summary, I can say that Lorient filler's high resilience allows the filler to maintain its structural form and the position within frequently moving skin areas such as the lips. And actually, me and my colleagues in my society actually did a study to find out what Lorient can do on the lips, and the result Well, as shown in this slide, Lorient number 2 and number 4, especially number 4, not only enhanced the volume of the lip, but also redefined their shape for a more attractive appearance. If I have to choose the left and right lips, definitely I'll choose the right one. It's more attractive. And when we take a look at the patient's face in the profile view, actually this patient received one syringe of Lorient number 4 filler on the upper and lower lip. And definitely we can appreciate that Lorient filler can create a distinct upper lip lift effect. So that's because our lips are complex in all dynamics. But anyway, injecting a suitable product along the labial border, lip border, can augment, not only give the volume, but also change the shape of the lip, and also in the upper lip area, those change of the shape will have some lifting of the upper lip, which will shorten the look of the elongated columella area, and that makes the patient look much younger. And in Korea, actually, that is really, really in fashion because in general, Korean females have very big upper lip. Right. Additionally, Lorient filler's osmolarity is quite similar to that of skin and fat of our body. So that means reduce the swelling after injection. And that's very important when we are doing the lip injection, right? So that's one of the reasons I prefer to use Lorient number 2 or number 4 on the lips. And finally, the nose, as you see here. Again, this is like forehead. The skin and the soft tissue here in nose area is very tightly bound to the underlying cartilage and the bone. So that means it's one of the high stiffness area in the face, right? For example, at the nasal tip area, the stiffness, the environment is so stiff, so the stretch on the nasal tip is nearly zero. So that's why when we are doing the injection on the nasal tip, we should be very careful because there is not much space over there, so we can easily compress the arteries there. But anyway, again, if you want to change the shape of the nose using fillers, we definitely need the very elastic and cohesive filler. So, and that is the Lorient number 6 because that gives sufficient support and that because it's very cohesive, they don't migrate laterally a lot. So maybe you can say that in areas like the nose and the chin, Lorient number 6 is the best one because it can serve as the structural pillar of the face. My patient, in total, 0.75 milliliter, so it's less than 1 syringe of Lorient number 6 all along the midline of the nose. And the result is stable, very stable and redefined, even under the great pressure of the tight nasal skin of Korean patients. Korean patients have really, really tight and stiff skin and soft tissue on the nose. So by matching the rheology to each zone, like in this patient, I used number 6 for the forehead and the chin, number 4 for the cheeks, and number 2 for the under eye areas. Under eye area, number 2 definitely, but I have to say that we have to think about the injection depth. Actually, when we use Lorient number 2 in the teardrop area, what matters is the injection depth. Because Lorient number 2, of course, it is very soft filler when compared to number 4 and number 6, but it is still very cohesive and a little bit more elastic than the competitors. So if we inject Lorient number 2 under eye area superficially, that can make lumps, which is not good in other eye area. So under the orbicularis ocular muscle, that is the key point. So in summary, I can say that Lorient number 246 is a filler that can give us the resilient durability. Not a simple stiffness, not a simple elastic filler. It's a resilient and durable. And one more thing, there are some tips for you. First, think about the categorized facial joints by their movement frequency. Okay? For example, high frequency joints like the lips, low frequency joints like the lateral cheek, and the high compression joints like the nose and chin. So categorize facial areas by movement frequency. And maybe we can think about the mobility gradient. Usually the medial central part of our face is very mobile, and the lateral part of our face is relatively fixed. So the choice of the filler can be determined according to that categorization. Last tip is about the thickness and stiffness paradox. Remember that thicker tissue is not always stiff. For example, the jawline area has a thicker skin and soft tissue here than forehead, but it is much more compliant than the forehead, right? So the real factor in to determine the stiffness is not the thickness per se. It's rather more related to collagen density in that tissue. So this understanding will help you choose your injection depth and the filler choice. Thank you very much.
Thank you for showing your excellence in adaptive the physics into the physiology. And this is a Q&A session. We are just a little behind the schedule, but we'll bring on all the speakers into the podium and we'll get the questions or your precious comments from the audience. And if there is nothing to start, to give you some time